Sore throat, also known as pharyngitis, is the inflammation of the tube that carries food to the esophagus and air to the windpipe, causing discomfort or pain in the throat that worsens when swallowing. Sore throat usually results from a viral or bacterial infection that causes irritation and inflammation of the throat tissues. Its treatment depends on addressing the underlying cause. Sore throats or throat congestion are more common in the winter and are often associated with many causes, most commonly viral respiratory infections such as the common cold or flu. In this video, we will discuss the causes of sore throat, its symptoms, how to prevent it, and how to treat it with simple home remedies. If you know someone suffering from a sore throat, share this video with them to spread the benefit. What are the causes of a sore throat? The causes of a sore throat vary between infections, injuries, allergies, or medical conditions. Here we explain the causes of pharyngitis. Viral infections. Viral infections are among the most common causes of a sore throat, and they include common cold, influenza, chickenpox, measles, mononucleosis caused by the Epstein-Barr virus, coronavirus, diphtheria, mumps, HIV, bacterial infections. A sore throat may also be caused by a bacterial infection. The most common one is streptococcal bacteria, which affects the throat and tonsils, especially in children. This type of sore throat is characterized by severe pain and may be accompanied by white spots on the throat. Allergies. A sore throat can result from allergies that arise from an immune reaction to allergens such as pet dander, dust, mold, pollen in the spring, or sensitivity to certain toxic chemicals. Other causes of sore throat. The causes of a sore throat may also be due to exposure to irritants like cigarette smoke, which can cause chronic inflammation if the person is continuously exposed. Other causes include dry air. Dry air can absorb moisture from the mouth and throat, causing dryness and itchiness. Speaking loudly or for long periods. Gastroesophageal reflux disease (GERD). Injury to the throat, such as food getting stuck or eating foods with sharp edges. Injury to the neck. Tumors, which include tumors of the throat or nearby organs such as the tongue. What are the risk factors for a sore throat? There are several factors that increase the risk of developing a sore throat, such as age. Children are more susceptible. Seasons. The incidence of sore throat tends to increase in winter compared to other seasons. Exposure to irritants, such as cigarettes or polluted air. Neglecting personal hygiene. This makes it easier to contract infections. Working in jobs that require loud speaking or singing. What are the symptoms of a sore throat? The symptoms of a sore throat vary based on the underlying cause. The most common symptoms include pain in the throat that worsens when swallowing or talking, difficulty swallowing, coughing, sneezing, and a runny nose, fever, which is particularly common with bacterial throat infections, where the patient's temperature may exceed 38.3 degrees Celsius 101 degrees Fahrenheit. Redness in the throat or the appearance of white patches. Swollen tonsils. Ear pain. Bad breath. Nausea and vomiting. Headache. General fatigue and loss of appetite. What are the risk factors for a sore throat? There are several factors that increase the risk of developing a sore throat, such as age. Children are more susceptible. Seasons. The incidence of sore throat tends to increase in winter compared to other seasons. Exposure to irritants, such as cigarettes or polluted air. Neglecting personal hygiene. This makes it easier to contract infections. Working in jobs that require loud speaking or singing. How is a sore throat diagnosed? A sore throat associated with the common cold may disappear within a few days without needing to see a doctor. However, certain cases require a doctor's visit as soon as possible, such as severe sore throat that does not improve or persists for more than 2 days in children, body temperature exceeding 38 degrees Celsius, swelling in the neck, difficulty breathing, noticing blood and saliva or phlegm, appearance of a rash, pale or bluish lips, The doctor diagnoses a sore throat by taking a medical history and understanding the symptoms the patient is experiencing, then examining the throat and neck. The doctor may also request some tests such as taking a throat swab and conducting a culture to identify the type of bacteria causing the infection. Blood. When should you see a doctor? If your child is ill, you should consult a doctor if your child's sore throat does not improve with the first drink in the morning, according to the American Academy of Pediatrics. Seek immediate care if your child has severe signs and symptoms, such as difficulty breathing, difficulty swallowing, unusual drooling, which may indicate an inability to swallow. For adults, you should see a doctor if you have a sore throat along with any of the following issues, as stated by the American Academy of Otolaryngology Head and Neck Surgery. Severe sore throat, or a sore throat lasting more than a week. Difficulty swallowing. Difficulty breathing. Difficulty opening the mouth. Joint pain. Earache. Rash. Fever exceeding 101 degrees Fahrenheit 38.3 degrees Celsius. Blood and saliva or phlegm. Frequent sore throats. A lump in your neck. Hoarseness lasting more than 2 weeks. Swelling. How can a sore throat be treated? A sore throat can be treated in 2 ways: natural remedies and medications. Natural remedies. You can use the following home ingredients to help relieve and treat a sore throat. Lemon helps get rid of mucus stuck in the throat. You can drink fresh lemon juice with honey. Apple cider vinegar has antibacterial properties that help get rid of a sore throat. Cinnamon, used since ancient times to treat a sore throat caused by a cold. Garlic has antiseptic and antibacterial properties that help treat a sore throat. Consume a raw clove of garlic once a day. Honey has antibacterial properties that combat the cause of a sore throat. Add it to a cup of tea or lemon juice. Gargling with warm salty water helps disinfect the affected area. Over-the-counter medications. You can also use some over-the-counter medications such as lozenges to relieve pain. Sucking on lozenges increases saliva concentration in the mouth and helps to moisturize the painful area. Steam inhalation. Using a steam inhaler may relieve symptoms, especially in cases of a sore throat caused by dry air or mouth breathing. Sprays. These sprays moisturize the mouth and contain pain relievers. Antibiotics for bacterial sore throat. Antibiotics are used to treat severe sore throats caused by bacteria, including penicillin, amoxicillin, cephalexin, azithromycin, erythromycin, ceftriaxone. Pain relief. Oral pain relievers can be taken to manage pain. In difficult cases where the patient does not respond to any of the above treatments and continues to experience problems and difficulty swallowing, doctors may prescribe glucocorticosteroids to help the patient overcome the severe symptoms. In conclusion, the above remedies and tips may help treat a sore throat and alleviate symptoms. However, if the sore throat persists for more than a week, is accompanied by a high fever or chills, or if the patient has conditions such as diabetes or a weakened immune system, it is important to consult a doctor for appropriate treatment. Please don't forget to like the video, subscribe to the channel, and we wish you a speedy recovery. Thank you for watching.